So welcome everyone. I want to thank you for joining the Caregiver Society for coping with trauma during COVID-19. Today I have our guest speaker who is Reverend Chris Kimmenez. Reverend Chris is a chaplain, a psychologist, and he's also a pastor. He's the state director for Healing Communities for the state of Pennsylvania and a lot more. So today with Reverend Chris, I just want to talk about trauma, primarily for caregivers. What is trauma? What are the causes? What are the symptoms? How do we treat trauma? And more importantly, we'll begin a discussion on COVID-19 and the effects that it has on vulnerable communities, Black and Brown people. Chris, thank you so much for joining me and being available at the last minute. I know that you are super busy, so I am very grateful for your time that you will be sharing with us. Before we start, can you just give a background on your professional experience with trauma and mental health recovery?
Okay, so well, for me, first I'll start out with personal experience. I'm a retired Marine, 4-time combat veteran. And so I, in the early 2000s, started dealing, and kind of in the late 90s, I'm a Desert Storm vet, and from a bunch of the little conflicts that happened in the 90s. And I was having some issues with PTSD myself upon retiring from the military. And so that kind of drove my interest into trauma. I was already studying mental illness in school. I have a PsyD. And so when I was working on my doctorate, I started really noticing some things in myself. And so that really had brought me an interest in trauma. So I began, my specialty in psychology is I have an additional specialty in trauma therapy. So that's kind of what drove out of personal experience and things that I was, as a person, as a military veteran dealing with, combat stress. So that's kind of what brought me into it. And, so now I've been working in, as in addition to being a pastor and a clinical chaplain, working as a trauma therapist now for almost 20 years.
Well, the best experience is personal experience. So let's just begin with our segment today. Mm-hmm. First, beginning with the definition of trauma. What is trauma?
So honestly, trauma has less to do with what we would define. So we all could probably come up with some things that we would consider traumatic. And so, and they vary from individual to individual. So what's traumatic for you may not be traumatic for me, and vice versa. What determines whether or not it's traumatic is the response that the person has to the incident, and that's what really determines trauma is. One of the differences between trauma and, say, mental illness is all the other things that we might talk about that are sometimes even associated with trauma, things like depression, anxiety, psychosis, that are mental illnesses. Trauma is not a mental illness. Trauma is an injury, even though it's an emotional one. It is still an injury. So the brain actually responds differently than it would if we were dealing with an illness. Sort of like, just like you don't have, if you're, you don't go to the foot doctor for a heart problem. So that we treat trauma differently. It's similar to the difference between mental illness and traumatic brain injury. That in the way that we treat them, they have a lot of the same symptoms, but they actually have very different root causes. So that's what trauma is. It's an emotional injury to the brain, and the brain processes it as an injury and not as an illness. So we have different ways of treating it, different ways of dealing with it, even though they both, talk therapy, for instance, is a part of it, exposure to a part of, but the approach is very different. And in fact, if someone's not trained in trauma, a therapist who's not trained in trauma should not be working with individuals who are dealing with trauma, because you actually can cause more harm than good. Models have even shown that it is better for someone almost to not go to any therapy than to go to a therapist who's not been trained in trauma. So I always tell people, make sure that when you send, when you're referring someone to, make sure they are an actual certified trauma therapist, that they provide what's called trauma informed care. Because if not, they'll mess somebody up.
So you would say that trauma is our body's response to events that have happened in our lives that has caused some sort of injury.
Yes. And they don't have to necessarily be direct either. It's not something that necessarily has to happen. There's what we call vicarious trauma, which means that that happens in two ways. Either you witnessing something, like say you were the witness to a car accident. You may have not been in the car accident, but you just witnessed it. And that can sometimes be more impactful than it actually happening to you. So, so for instance, if anybody's ever seen someone have like a bad fall and they got up and just kind of shook it off and went on about their business, but you're still kind of shaken up from seeing it, that's what we mean by vicarious trauma. And of course that could be more impactful depending on the other thing with caregivers is it is sort of a cumulative effect. With caregivers, with therapists, with providers, it becomes like a cumulative effect because we're dealing with other people's stuff all day long. And if we're not careful and we take that, then that becomes sort of like a cumulative vicarious trauma, and then you start, then we wonder why therapists burn out, why sometimes social workers burn out, caregivers burn out, because they're dealing with other people's stuff all day long. And so you have to learn how to not sort of take it home with you. But that's really hard if you're an empathetic person. So we talk about how this really over a period of time can be very impactful. So it doesn't necessarily have to happen directly to you to still traumatize you.
So I think with what's going on right now during the COVID-19 and the health crisis, would you say that there is a lot of vicarious trauma that is taking place as many of us are tuned into the news, tuned into social media, know someone who has a family member affected? We may be directly affected by it, in addition to what else is going on as far as family and friends may have regular medical conditions that are now not able to go to the doctors or go to the hospitals to get seen because COVID right now is more important. In addition to having loved ones or friends who are dying, not being able to see them or talk to them before they pass away. And then this new state of being that we're in, where we are now, some of us are attending viewings and funerals over video platforms like Zoom or Facebook Live. I myself attended a viewing for a family member over Zoom, and it was very strange. I myself have friends and who I have not been able to see or speak to before the person passed away due to the social distancing and the new hospital policies of not visiting friends and loved ones. So the reason why why I wanted to have this series and to have this particular segment is to not only discuss how trauma is affecting caregivers, but how the general public might be affected as well. With some people being able to stay home, not being able to leave out the house, and having daily activities interrupted, to the caregivers and the essential workers who have to leave out the house to go to work, who are putting their health at risk. And it's no secret that they don't have proper PPE. Caregivers are not receiving the proper PPE from their agencies to enter into their clients' homes. Some caregivers I know have been quarantined and now they're not able to be around their family members that they once took care of, nor are they able to be around their clients who they were once taking care of. And so that's another level of worry, because, you know, as a caregiver, you feel as though no one else can care for your loved one or your client the way that you can. So now, with some caregivers being away from their loved ones and their clients, they're not able to see what's going on in the homes or in the facilities where they're working. So I believe that there is a lot of injury, that emotional injury that is taking place right now with all of us, but primarily caregivers and healthcare workers. And on top of that, to be part of a vulnerable community, which is Black and Brown people. And yes, we have underlying health conditions, some of us. However, we know that the reasons why there are health disparities or any other disparities in America is not because of someone's individual health choices. It is because of institutionalized racism. So regardless if you have money or not, go to college or not, live in the suburbs or the city, it does not matter if you are Black or brown. And some of those reasons are because of implicit bias. When you go into the hospitals, you are not treated fairly because of stereotypes. So let's just talk about, we talked about some of the causes of trauma and what trauma is. Let's discuss the symptoms of trauma. How can someone identify whether or not they are experiencing trauma?